It begins quietly. A slight headache, a fever, maybe a sore neck. You think it's the flu, stress, or just a long day catching up with you. But what if it's not? What if these small signs are the first warnings of something much more dangerous? Something that could take your life within hours? This is meningitis, a silent, swift, and sometimes deadly condition that doesn't wait for anyone. But here's the good news. Understanding it can save your life, or the life of someone you love. In this video, we'll break down everything you need to know about meningitis in a way anyone can understand. What causes it, how it spreads, how to recognize the symptoms, and most importantly, how to protect yourself. And we'll also tackle the myths, because misinformation can be as dangerous as the disease itself. Whether you're a parent, a student, or just someone who wants to stay informed, this video is for you. Meningitis doesn't discriminate. It can affect anyone, at any time. So please subscribe, like and share this video to your loved ones. Let's dive in and learn how to protect ourselves and others from this hidden threat. Meningitis is an infection that targets one of the body's most vital defenses, the meninges. These are the protective layers that surround your brain and spinal cord, acting like a shield to keep your central nervous system safe. But sometimes, harmful invaders break through this shield. These invaders could be bacteria, viruses, fungi, or even parasites, causing the meninges to become inflamed. This inflammation disrupts the delicate environment inside your brain and spinal cord, leading to a dangerous chain reaction. Have you ever shared a drink, hugged a friend, or sat in a crowded bus? If so, you might have unknowingly come into contact with meningitis. Meningitis isn't some far-off disease. It spreads in ways that might surprise you, through sneezes, coughs, kissing, or even sharing utensils. These simple acts can transfer the germs that cause meningitis from one person to another. In crowded places like classrooms, bacteria or viruses can travel easily through respiratory droplets. Shared surfaces and close proximity in public transport can also be hotspots for transmission. Living in close quarters like dormitories or summer camps increases your risk of exposure. This is one of the most dangerous misconceptions. Some forms of meningitis, like bacterial and viral meningitis, are highly contagious and can spread from person to person. However, other forms, such as fungal or non-infectious meningitis, cannot be passed between people. Knowing the type of meningitis is crucial for understanding how it spreads. Meningitis spreads more easily than you might think. But don't worry. Awareness is your first line of defense. In the next chapter, we'll explore the signs and symptoms you need to watch out for. When it comes to meningitis, every second counts. The difference between life and death, recovery, and lifelong complications is speed. Here are the red flags you need to know. Fever and a sudden severe headache are often the first signs. These symptoms can appear quickly and escalate even faster. A stiff neck is another hallmark sign. If you or someone you know struggles to move their neck without pain, don't ignore it. Nausea, vomiting, confusion, or sensitivity to light can also point to meningitis. These symptoms might seem unrelated, but together they paint a dangerous picture. In some cases, a purple bruise-like rash may appear. This can signal blood poisoning, a life-threatening complication of bacterial meningitis. If you see this, seek help immediately. These symptoms can escalate alarmingly fast, especially in children, teens, and young adults. What starts as a headache or fever can quickly turn into confusion, unconsciousness, or worse. If you or someone you know shows these symptoms, seek medical attention immediately. Meningitis is serious, but the good news is that there are ways to protect yourself and your loved ones. Prevention is your best defense, and early treatment can make all the difference. Vaccination is your first and most effective defense against meningitis. Meningococcal vaccines protect against the most dangerous types of bacterial meningitis and are recommended for children, teenagers, and adults in high-risk groups. Good hygiene can go a long way in preventing the spread of meningitis. Wash your hands frequently, don't share utensils, and cover your mouth or nose when coughing or sneezing. During an outbreak, avoiding close contact in crowded areas can reduce your risk of exposure. Bacterial meningitis is a medical emergency. It requires immediate hospitalization and intravenous antibiotics to stop the infection and reduce complications. Delaying treatment for bacterial meningitis can result in brain damage, hearing loss, or death. Viral meningitis is usually less severe and often resolves on its own. However, you should always consult a doctor to rule out more serious infections and to get proper care. Fungal meningitis, though rare, requires antifungal treatment and often affects those with weakened immune systems. Prevention saves lives. Vaccines, good hygiene, and prompt action are your best tools in the fight against meningitis. If you or someone you know shows symptoms, don't wait. Act fast and consult a doctor immediately. Protect yourself. Protect others. Together, we can stop meningitis.